CEN exam prep. Question 1. A patient's ABG results show pH 7.25, PaCO 255 mmHg, HCO 24 milliequivalent/L. What is the most likely interpretation? Option A, metabolic acidosis. Option B, metabolic alkalosis. Option C, respiratory acidosis. Option D, respiratory alkalosis. The correct answer is option C, respiratory acidosis. The ABG shows a low pH, acidemia, elevated PaCO 2, greater than 45 mmHg, and normal HCO3. This is consistent with acute respiratory acidosis from hypoventilation. Metabolic acidosis, A, would show a low HCO3. Metabolic alkalosis, B, would show elevated pH and HCO3. Respiratory alkalosis, D, would show low PaCO 2. Question 2. A patient presents with a swollen, painful ankle following a fall. The nurse notes that the patient is unable to bear weight. Which test should be performed to guide the need for X-raise? Option A, Ottawa ankle rules. Option B, pivot shift test. Option C, Lockman test. Option D, McMurray's test. The correct answer is option A, Ottawa ankle rules. The Ottawa ankle rules are clinical decision rules to determine whether X-rays are needed for ankle injuries. Inability to bear weight is one criterion that indicates the need for X-rays. Pivot shift, B, and Lockman, C, test the knee for ACL injury. McMurray's test, D, tests for meniscal injury. Question 3. A patient has been exposed to cyanide. What is the most characteristic finding? Option A, cherry-red skin. Option B, cyanosis. Option C, slate-gray skin. Option D, flushing. The correct answer is option A, cherry-red skin. Cyanide poisoning causes a classic cherry-red skin color due to high venous oxygen saturation from impaired cellular oxygen utilization. Cyanosis, B, is seen in hypoxia from other causes. Slate-gray skin, C, is seen in methemoglobinemia. Flushing, D, is nonspecific. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient presents with a patellar dislocation. The nurse should monitor for associated injury to the Option A, femoral artery. Option B, sciatic nerve. Option C, popliteal artery. Option D, tibial nerve. The correct answer is option C, popliteal artery. Patellar dislocation can cause injury to the popliteal artery, which lies behind the knee joint. The nurse should assess distal pulses and capillary refill. Femoral artery, A, is more proximal. Sciatic nerve, B, is more posterior. Tibial nerve, D, is also in the popliteal area, but the popliteal artery is the most critical vascular structure. Question 5. A patient is diagnosed with acute appendicitis. The nurse is particularly concerned if the patient reports which symptom. Option A, sudden relief of pain. Option B, nausea and vomiting. Option C, right lower quadrant pain. Option D, rebound tenderness. The correct answer is option A, sudden relief of pain. Sudden relief of pain in a patient with suspected appendicitis may indicate perforation of the appendix. This is a serious complication requiring immediate surgical intervention. Nausea and vomiting, B, right lower quadrant pain, C, and rebound tenderness, D, are all expected findings in appendicitis. Question 6. In triaging a patient with abdominal pain and a fever of 102 degrees Fahrenheit, the nurse should assign which triage category based on the Emergency Severity Index, ESI. Option A, ESI 1. Option B, ESI 2. Option C, ESI 3. Option D, ESI 4. The correct answer is option B, ESI 2. ESI 2 is for high-risk patients who are not in immediate danger but require rapid assessment and treatment. A patient with fever, 102 degrees Fahrenheit, and abdominal pain meets criteria for ESI 2, high minus risk. ESI 1A is for life minus threatening conditions requiring immediate intervention. ESI 3C is for stable patients requiring 1 minus 2 resources. ESI 4D is for stable patients requiring no resources. Question 7. A patient with anorexia nervosa presents with significant electrolyte abnormalities. Which electrolyte finding is most concerning? Option A, hypokalemia. Option B, hyponatremia. Option C, hyperkalemia. Option D, hypercalcemia. The correct answer is option A, hypokalemia. Hypokalemia is the most common and concerning electrolyte abnormality in anorexia nervosa, particularly related to purging behaviors. It can lead to cardiac arrhythmias, weakness, and QT prolongation. Hyponatremia, B, can occur but is less common. Hyperkalemia, C, is not typical of anorexia. Hypercalcemia, D, is not associated. Question 8. A patient with diabetes presents with a blood glucose of 550 mg/dl, serum osmolality of 320 mosm/kg, and a serum pH of 7.35. What is the most likely diagnosis? Option A, diabetic ketoacidosis, DKA. Option B, hyperosmolar hyperglycemic state, HHS. Option C, hypoglycemia. Option D, lactic acidosis. The correct answer is option B, hyperosmolar hyperglycemic state, HHS. HHS is characterized by severe hyperglycemia, greater than 600 mg/dl, elevated serum osmolality, greater than 320 mosm/kg, and absence of significant ketosis or acidosis, pH greater than 7.3. DKA, A, presents with acidosis, pH 7.3, and ketones. Hypoglycemia, C, presents with low blood glucose. Lactic acidosis, D, has normal glucose. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. Which of the following is a true statement about do minus not minus resuscitate, DNR, orders? Option A. A DNR order indicates no further care should be given. Option B. A DNR order is a standing order for all patients. Option C. A DNR order is written by a physician after discussion with the patient or family. Option D. A DNR order can be written only by the patient's family. The correct answer is option C. A DNR order is written by a physician after discussion with the patient or family. DNR orders are written by a physician after discussion with the patient or healthcare proxy. DNR does not mean no care, A, it means no CPR. DNR is not a standing order, B. Family, D, cannot write the order but can participate in discussion. Question 10. A patient arrives with a chief complaint of the worst headache of my life. Which of the following is the priority nursing action? Option A, administer pain medication. Option B, perform a neurological assessment. Option C, prepare the patient for a CT scan. Option D, establish for access. The correct answer is option C, prepare the patient for a CT scan. Worst headache of my life is a classic presentation for subarachnoid hemorrhage. A non-contrast CT scan is the priority diagnostic test. While neuroassessment, B, is important, the CT is diagnostic and should not be delayed. Pain medication, A, and for access, D, are important but secondary to diagnosis. Question 11. A patient presents with signs of sepsis. Which of the following is the most important early intervention? Option A, administer broad-spectrum antibiotics. Option B, administer 4 fluids. Option C, obtain blood cultures. Option D, start a vasopressor. The correct answer is option C, obtain blood cultures. In sepsis, blood cultures should be obtained before starting antibiotics to identify the causative organism. Antibiotics, A, should be given as soon as possible but after cultures. 4 fluids, B, are given simultaneously with cultures. Vasopressors, D, are started after fluid resuscitation. Question 12. A patient presents with tachycardia, palpitations, and weight loss. What endocrine disorder is most likely? Option A, hyperthyroidism. Option B, hypothyroidism. Option C, diabetes mellitus. Option D, Cushing's syndrome. The correct answer is option A, hyperthyroidism. Hyperthyroidism presents with tachycardia, palpitations, weight loss, anxiety, and heat intolerance. Hypothyroidism, B, presents with bradycardia, weight gain, and cold intolerance. Diabetes, C, presents with polyuria, polydipsia, and polyphagia. Cushing's syndrome, D, presents with weight gain, moon phases, and hypertension. Question 13. Which of the following ECG findings is most consistent with pericarditis? Option A, ST-segment elevation in all leads with reciprocal depression. Option B, diffuse ST-segment elevation with PR-segment depression. Option C, ST-segment elevation in contiguous leads with reciprocal changes. Option D, pathologic Q waves in leads 2, 3, and AVF. The correct answer is option B, diffuse ST-segment elevation with PR-segment depression. Acute pericarditis classically presents with diffuse, global, ST-segment elevation across most leads along with PR-segment depression. The ST-segment elevation is concave upward and does not have reciprocal changes. Option A describes STEMI, which typically shows ST elevation in contiguous leads with reciprocal depression. Option C also describes STEMI. Option D describes a prior inferior wall ME. Question 14. A patient presents with acute urinary retention. The nurse anticipates the need for Option A, Foley catheter insertion. Option B, straight catheterization. Option C, condom catheter. Option D, suprapubic catheter insertion. The correct answer is option A, Foley catheter insertion. For acute urinary retention, insertion of a Foley catheter provides continuous drainage and allows monitoring of urine output. Straight catheterization, B, may be used, but Foley is preferred to prevent repeated catheterizations. Condom catheters, C, are for incontinence, not retention. Suprapubic catheter, D, is used when urethral catheterization is not possible. Question 15. A patient presents with a jellyfish sting. Which of the following is an appropriate first-aid measure? Option A, apply fresh water to the area. Option B, apply vinegar to inactivate nematocysts. Option C, apply heat to the area. Option D, rinse with seawater and apply ice. The correct answer is option B, apply vinegar to inactivate nematocysts. Vinegar, acetic acid, should be applied to jellyfish stings to inactivate the nematocysts and prevent further venom release. Fresh water, A, can cause nematocysts to fire. Heat, C, is sometimes used for pain relief but not for inactivation. Rinsing with seawater, D, is acceptable but vinegar is preferred. Question 16. In a mass casualty incident, which patient would be classified as green minor, according to START triage? Option A, a patient with a fractured femur, respirations 20/min, pulse 100, able to follow commands. Option B, a patient with an open fracture of the tibia, respirations 24/min, pulse 110, able to follow commands. Option C, a patient with a sprained ankle, respirations 18/min, pulse 90, able to walk. Option D, a patient with a large scalp laceration, respirations 22/min, pulse 100, confused. The correct answer is option C, a patient with a sprained ankle, respirations 18/min, pulse 90, able to walk. In START triage, green minor, patients are those who are walking and have minor injuries. The sprained ankle patient who can walk is green. Fractures, A, B, are typically yellow delayed. Confusion, D, is a concern and may indicate need for more urgent care. Question 17. A patient presents with a severe allergic reaction with difficulty breathing and hypotension. What is the priority medication? Option A, diphenhydramine. Option B, epinephrine. Option C, albuterol. Option D, hydrocortisone. The correct answer is option B, epinephrine. Anaphylaxis is a life-threatening emergency requiring immediate epinephrine. Epinephrine is the first-line treatment for anaphylaxis with respiratory or cardiovascular compromise. Diphenhydramine, A, albuterol, C, and hydrocortisone, D, are all used but are secondary to epinephrine. Question 18. Which of the following is a priority intervention for a patient with priapism? Option A, administer pain medication. Option B, apply ice to the genital area. Option C, prepare for surgical intervention. Option D, administer oxygen. The correct answer is option C, prepare for surgical intervention. Priapism is a prolonged erection lasting more than 4 hours, which can lead to ischemic injury and permanent erectile dysfunction if not treated promptly. The priority is to prepare for interventions such as aspiration, irrigation, or injection of sympathomimetic agents. Pain management, A, and ice, B, may be used but are not the priority. Oxygen, D, is not the primary intervention. Stressed your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. In a patient with suspected acute coronary syndrome, which of the following is the priority nursing action upon arrival? Option A, obtain 12-lead ECG within 10 minutes. Option B, start 2 large -bore 4 lines. Option C, administer chewable aspirin. Option D, draw cardiac enzymes. The correct answer is option A. Obtain 12-lead ECG within 10 minutes. The priority for suspected acute coronary syndrome is a 12-lead ECG obtained within 10 minutes of arrival. Rapid identification of STEMI allows for timely reperfusion therapy. While aspirin, C, should be given promptly, the ECG is the priority for diagnosis. For access, B, and lab draw, D, are important but follow the ECG. Question 20. A patient is scheduled for an abdominal CT with oral contrast. Which finding in the patient's history may require special preparation or alternative imaging? Option A, diabetes mellitus. Option B, hypertension. Option C, allergy to shellfish or iodine contrast. Option D, asthma. The correct answer is option C, allergy to shellfish or iodine contrast. Allergy to shellfish or iodine contrast is a concern due to cross-reactivity with 4 contrast agents. Pre-medication with steroids and antihistamines may be needed. Diabetes, A, and hypertension, B, are less significant. Asthma, D, is relevant but less directly impactful. Question 21. A patient has a Glasgow Coma Scale, GCS, score of 7. What does this indicate? Option A. The patient is neurologically intact. Option B. The patient has a moderate brain injury. Option C. The patient has a severe brain injury. Option D. The patient is brain dead. The correct answer is option C. The patient has a severe brain injury. GCS scores are interpreted as 13-15 mild brain injury, 9-12 moderate brain injury, and 3-8 severe brain injury. A score of 7 indicates severe brain injury requiring intubation and ICU care. This patient is not intact, A, does not have moderate injury, B, and is not brain dead, D. Question 22. A patient with acute pancreatitis has the following labs. Which finding is most concerning? Option A, elevated serum amylase. Option B, elevated serum lipase. Option C, elevated blood glucose. Option D, decreased serum calcium. The correct answer is option D, decreased serum calcium. Hypocalcemia in acute pancreatitis is a poor prognostic sign. It occurs due to saponification of calcium with fatty acids in necrotic fat tissue. Hypocalcemia can also indicate severe pancreatitis with significant necrosis. While elevated amylase, A, and lipase, B, are diagnostic, they do not indicate severity. Elevated glucose, C, is common but less concerning than hypocalcemia. Question 23. A patient presents with sudden onset of sharp chest pain and dyspnea following a long flight. What is the most likely diagnosis? Option A, spontaneous pneumothorax. Option B, pulmonary embolism. Option C, acute coronary syndrome. Option D, pericarditis. The correct answer is option B, pulmonary embolism. This patient has risk factors, prolonged immobility from a long flight, and classic symptoms of pulmonary embolism, sudden dyspnea and pleuritic chest pain. While spontaneous pneumothorax, A, can cause similar symptoms, the history of prolonged travel makes PE more likely. ACS, C, presents with chest pressure with radiation. Pericarditis, D, pain is positional. Question 24. A patient who is intubated and mechanically ventilated has a sudden decrease in SpO2 from 95% to 85%. The ventilator alarms are sounding with high peak pressures. What is the first action? Option A, increase VO2. Option B, assess for a disconnection. Option C, manually ventilate with a bag-valve mask. Option D, suction the endotracheal tube. The correct answer is option C, manually ventilate with a bag-valve mask. When an intubated patient experiences a sudden drop in SpO2 with high pressure alarms, the immediate action is to disconnect from the ventilator and manually ventilate with a bag-valve mask, BVM. This allows assessment of breath sounds, compliance, and tube patency. Increasing VO2, A, may help briefly but does not address the underlying issue. Suctioning, D, may be needed later. A disconnection, B, would cause low pressure alarms, not high pressure. Question 25. A patient presents with nuchal rigidity, photophobia, and altered mental status. What is the priority diagnostic test? Option A, CT scan of the head. Option B, lumbar puncture. Option C, MRI of the brain. Option D, the blood cultures. The correct answer is option A, CT scan of the head. While lumbar puncture, B, is diagnostic for meningitis, a CT scan of the head must be performed first to rule out increased intracranial pressure, which would make lumbar puncture dangerous. Blood cultures, D, should be obtained but after CT, MRI, C, is not the initial test.